Good morning, everyone. I am very happy that this conference is taking place and I will be making a small contribution. I speak a few words about San Luis province in Argentina. According to data from the World Obesity Atlas 2025 and a study published in the Lancet, 73 of adults in Argentina have an elevated body mass index and nearly 40% live with obesity. In 2021, more than 10,500 premature deaths in the country were attributed to elevated BMI. According to the most recent survey of risk factors conducted by the Ministry of Health in 2018, approximately 36% of the Argentine population is overweight, and roughly one in four Argentinians lives with obesity. Compared to the first ENFR in 2005, obesity increased by 72%. An urban study in the city of San Luis in the year 2023, a cross-sectional observatory study involving 306 individuals aged 18 to 85 years in the city of San Luis, carried out by research teams from National San Luis University, found that 73% of participants had obesity, 11% had arterial hypertension, 3% had diabetes, 3% had dyslipidemia, and 13% had ischemic coronary complications. Overall, so 26 and 8% of participants presented at least one of these conditions. A low level of education was possibly associated with obesity, and women show a higher likelihood by hypertension and heart disease. Greater age and lower educational achievement increases the probability of obesity and metabolic comorbidities. What happened in the rural population in San Luis? The first epidemiological study of non-communicable disease in rural population of the Juan Martín de Pueyrredón department, San Luis, was published in 2024. There has been a historical deficit of epidemiological data and NCD profiles in rural Argentina, since the national ENFR surveys only cover localities with more than 5,000 inhabitants. The study includes 808 adults from four rural localities with physical and biochemical measurement alongside socio-demographic questionnaires. It was cross-sectional study conducted between September and November 2017 with age and sex adjusted estimate. The ENFR provides information on risk factors such as tobacco and alcohol consumption, diet, physical activity, and prevalence of hypertension, diabetes, and obesity, with national and provincial representativeness for localities of 100,000 or more inhabitants. Well, uh, first, what factors explain the deterioration of nutritional profiles? Obesity acts as a common risk factor for chronic disease such as diabetes, hypertension, lipidemia, and cardiovascular disease. Its prevalence is influenced by biological, psychological, and behavioral factors. Among children and adolescents aged 5 and 15 oversight reaches 20% and obesity 24%. For most, no new ENFR has been in conduct since 2019, creating data gap that encompasses the COVID-19 pandemics, period marked in increased sedentary behaviors and poor dietary habits. Several obesity is projected to grow dramatically in Argentina by 2030. It is expected to affect more than 2 million men and more than 3 million women. This study conducted with adults in San Luis confirms that unfavorable socioeconomic and conditions, low educational attainment, and low income are directly associated with higher prevalence of obesity and its metabolic comorbidities. This trend is consistent with observation across Argentina and Latin America. There is no provincial nutrition surveillance systems which continues data series from 2015 to 2025. This is about the carbon gaps. The other is the 50 and 5 respect in 2022 and 2023 has not been published with updated provincial data. There is limited research on dietary patterns among vulnerable population. Indigenous communities are the zones in the north parts of the province. Suggest community action areas. We can think in integrate school health programs with systematic anthropometric assessments, strengthen the nutrition programs at National San Luis University as a generator of local epidemiological data, and coordinate with the Provincial Ministry of Health to establish continuous post-pandemic epidemiological surveillance. Well, this is a picture. We can think in the future actions. This is all, and thank you very much for your attention.